Huntington's disease is a genetic degenerative brain disorder that causes damage to the thought and movement centers of the brain. Some of the first signs and symptoms of Huntington's disease are sudden clumsiness and changes in temperament, including mood swings and uncharacteristic, inappropriate social behaviors. As the disease progresses, sufferers will experience involuntary movements including athetosis, which is twisting or writhing movements, and chorea, which resembles jerky, uncontrolled dancing, and the eventual loss of reasoning, speech, and ability to swallow. Onset of Huntington's disease in children is very rare. Usually symptoms begin to manifest between the ages of 30 and 50. 30,000 Americans and 4 to 8 out of every 100,000 people worldwide have Huntington's disease. Women and men are equally as likely to inherit Huntington's disease, but the risk for people of European descent is 70 to 100 times higher than those of African or Asian descent, and 100% of people who inherit the gene for Huntington's disease will become ill. Huntington's disease is an autosomal dominant inherited disorder. This means that a person needs to inherit only one copy of the defective gene from either parent in order to develop the disease. Huntington's disease is caused by a genetic defect on a gene, the Huntington gene, which is found on chromosome 4. A genetic mutation in this gene causes part of the DNA called a CAG repeat sequence to repeat more than it should and form the protein named Huntington as a result. The Huntington protein accumulates within the cells of the basal ganglia and cortex. This accumulation is thought to be linked to cell degeneration in certain parts of the brain that are responsible for regulation of coordinated movement, emotional expression, perception, memory, and thinking. The accumulation of Huntington protein is thought to be the source of Huntington's disease. However, how Huntington protein causes the disease is still unknown. Huntington's disease can only be diagnosed through genetic testing. However, if a patient is suspected to have Huntington's disease, either through a family history of the disease or exhibition of symptoms, brain imaging tests, such as an MRI, may be performed to look for structural changes within the brain. Huntington's disease is a progressive, degenerative neurological disorder, ultimately leading to disability and death. Most people diagnosed with Huntington's disease live about 10 to 30 years following diagnosis, with an average disease duration of 19 years. Thank you for viewing our video about Huntington's disease, and please feel free to direct any questions you may have to Group 15.